Bismillah ar-Rahman ar-Rahim. Here a new OSCE case number 9. As we see in the clinical history, this patient is about 40 years old with acute on chronic headache. This is the first case, the first question. Describe the procedure and the radiological finding. As we see here in this brain CT scan, non-contrast study, and we see hyperdense mass centered in at the foramen minor, and it is associated with hydrocephalus, and it runs ependymal CSF leak. So hyperdense mass in the center in the foramen minor with hydrocephalus ependymal CSF leak. The third question, what are the differential diagnoses of this patient? The differential diagnosis sometimes a flow artifact in the MRI from it is called phase artifact. Sometimes in neoplastic condition like craniopharyngiomas, subependymomas, and choroid plexus lesions. And also in differential diagnosis, we have a neurocysticercosis, and we should look for other parenchymal and system lesion. The next question, what are the key features in your radiology report? The key features in this patient with colloid cyst we should mention the size of the cyst, and we should also mention the T2, if it is T2 signal of the cyst, low signal intensity, so it is difficult to aspirate. Sometimes it is associated with cavum septum pellucidum and vergi, we should mention that. And also when we give the contrast, we should also uh, see the presence and location of internal cerebral veins. Presence also we should mention other vascular abnormalities if there is surgical intervention. So this is simple case, colloid cyst, and at the foramen mono with hydrocephalus, and it runs ependymal edema due to CSF leak. We mentioned the differential diagnosis and the key feature in our radiology report. Thank you for listening and hoping to see you soon in another talk. سبحانك اللهم وبحمدك أستغفرك وأتوب إليك.